Well, welcome to this talk. Now, I've been getting lots of questions on fever. Is fever good? Is it bad? Should we treat fever? Should we not treat fever? So I wanted to give you a perspective on this. Now, of course, it's very useful to have a thermometer at home if you can. This is just an internet one. This is so my temperature there, according to this, is 36.7, which I guess is about 98 degrees Fahrenheit or something like that. So that's within a normal range. But of course, when we get sick with infections, then very often the fever goes up. We get what we call a temperature. Now, this doesn't always happen in COVID-19, but it frequently does. So the question is, normally now when I'm feeling fine, I don't have a fever. Then when I feel sick, I have a fever. So the tendency is to treat the fever. And when you treat the fever, you start to feel better. But is that the right thing to do or not? Now, to give you the bottom line on this video, if you haven't got time to watch, it's my firm conviction that for adults who are otherwise healthy, it's a good thing to let fevers run and not to treat fevers. Now, treating fevers is really quite simple. In fact, it's remarkably simple. So you can get someone who's feeling absolutely terrible. They feel really ill. They're shaky. They're shaky because the temperature's going up. And we can give them some of this stuff. Now, that's paracetamol. In the United States, you call it acetaminophen. It's exactly the same thing, Tylenol. This is just cheap supermarket one. This is really cheap. It's probably about 20 pence for that packet, something like that. So paracetamol or acetaminophen. And if you got a high fever, very often you just take those and your fever comes down in no time at all and you feel much better. But is that a good thing to do? Well, we think not for most people most of the time. Or ibuprofen, 400 milligrams of ibuprofen or a gram of paracetamol, absolutely standard fever treatment. So it's a very, very simple thing to bring fever down. But let's look at it in a little more detail now. So is fever good or bad? Well, the answer is nearly always, in the vast majority of cases, in otherwise healthy grown-ups, adults, it's a good thing. It is a protective response. The fever is supposed to be there. It's not an accident, and it's improving the efficiency of our immune system. And not only that, it's making the environment of the body much less pleasant for viruses and bacteria to live in. So there's a few good effects there, and there's other good effects as well. And from a healthcare provider, it's really useful to be able to monitor the progress of a condition. So you get someone admitted into A&E, for example, who's unwell, and they might have a normal temperature, but you think, oh, well, maybe they've got an infection because there's other indicators of infection. So what you always have to ask is, what is your temperature? Well, you have to record the temperature. Then you always have to ask, when did you last take paracetamol, acetaminophen, ibuprofen? Because that's going to artificially lower the temperature. And it makes diagnosis much more confusing. So a few good reasons there not to treat fever. So normal body temperature, as we've said, 36 to 37, I'm counting normal. That's 96.8 to 98.6 degrees Fahrenheit, I am counting as normal. Now, sometimes my body temperature is a little bit lower than 36. Sometimes it's a little bit higher than 37. As long as I'm feeling okay, I'm not feeling ill at the same time, then I don't worry about that. But my temperature is virtually always well, it's nearly always sort of 36 to about 36.7 is typical for me. And when I say typical for me, it does vary a little bit between people, but not much. We're all humans. We're all basically the same. Our enzymes work at the same temperature. So fever reduces illness severity and length is basically the conclusion that I'm giving. Now, why am I saying this? Well, let's just give us some examples. This is from Dr. Evans, Professor of Oncology, Immunology, New York. She says this: fever acts to mobilize multiple arms of the immune system, a function that is remarkably well conserved across many, many species, both warm-blooded and cold-blooded. Now, what she's saying here is that many, pretty well all vertebrates, I think, but many, many different organisms, when they're sick, they have a fever. So dogs get a fever when they're sick. Cats get a fever when they're sick. Birds get a fever when they're sick. A wide variety of animals get a fever when they're sick, so it's highly conserved. And of course, the ones that are getting fevers now come from ancestors who got fevers and didn't die. This is the process of natural selection. So that's what she means, it's highly conserved. Then she says fever affects every aspect of the immune system to make it work better. And it makes the environment less pleasant for bacteria and viruses. And it helps us diagnose infections. So plenty of good reasons not to treat fevers. Now, if you don't treat your fever, you're going to feel worse for a period of time, but this research is showing that you'll get better more quickly. And we'll also show some research from influenza that means you're less likely to get severe illness and potentially even die. So this is really quite an important point. This is why I'm bringing it up now. This paper here is a good review of this. Fever and the thermal regulation of immunity. The immune system feels the heat. Okay, so good title, but check it out for yourself. Thorough scientific paper. Let's look at some of the points from it. So conserved and warm and cold-blooded vertebrates. Now this is quite amazing. Many types of lizards that have been studied. When they're sick, they'll seek heat. They will go into a warm place and try and warm their body temperature up artificially. There's evidence that bumblebees do the same thing. So this is like everything does this. And the paper mentions specifically desert iguana, bluefin tuna, and leeches, those little blood-sucking things. Now, all of those, so they're cold-blooded, they're endothermic. Fish, of course, are endothermic, although tuna can regulate their body temperatures better than other fish. And leech are just those little blobby things. So but what it's saying is, if you give antipyretic drugs, that's acetaminophen, paracetamol, ibuprofen, to any of these creatures, any of these animals, they will stop trying to raise their body temperature and they will stop heat-seeking behaviour. Because, of course, when we're getting a fever, we have heat-seeking behaviour. So partly it's the body's turning its own temperature up. But we also put on the covers and put on the fire. So we seek heat. And giving antipyretics to these animals abolishes that response. So this shows that it's probably the same biochemical pathways in all of these organisms. And, of course, it's a long time since we had a common ancestor with leeches and bluefin tuna. Leeches especially, I would imagine, a long time ago. So it shows that this has been conserved throughout millions of years, 600 million years, in fact, of evolutionary change. And things are only conserved for that long period of time if they're very beneficial. So from an evolutionary perspective, it makes sense to say they're beneficial. Common biochemical pathways. So it looks like the way that all animals raise their body temperature uses the same chemical pathways. That can be abolished with ibuprofen and paracetamol, which is basically a cyclooxygenase inhibitor. It's the way it works, and the enzymes in the brain. Integrated physiological and neuronal circuitry. So we have all the physiological mechanisms, all the parts of the brain, all the nerves, all the endocrine effects that are designed specifically to induce fever. This is not a mistake. Fever is induced by chemicals released from white blood cells, pyrogens that affect the hypothalamus in the brain. The circuitry is all there. The cyclooxygenase pathways are all there. The hormonal response to raise the fever is all there. The neurological response to raise the fever, to raise the body temperature is all there. This is built in to our very structure as complex animals. It's not there by mistake. This is a very deliberate strategy. And the reason for this is it confers a survival benefit during infection. So the idea is that in the dim and distant past, animals that couldn't generate a fever, if an animal was born that couldn't generate a fever, then it would be selected out. It would get an infection, die before it had time to reproduce. Whereas animals that could generate fevers, they generated a fever when they had an infection. They therefore survived, therefore they reproduced, therefore they passed their fever generating genes on to the next generation. This is the way simple natural selection works. So fever, this article says fever stimulates innate and adaptive immune responses. Now, the innate immune response, innate immunity is the type of immunity that will act against a wide variety of potentially infecting organisms and viruses. So cells like natural killer cells will react against a lot of different types of infections. Cells called macrophages, the macro big phage to eat, the big eating cells, they will act against a wide variety of infecting organisms. So that's the innate immunity. But this article is saying it also stimulates the adaptive immune response. So the adaptive immune response is the specific immunity, the acquired immunity, whereby we make antibodies to a particular antigen, a particular infecting virus or bacteria, whereby we make memory T cells to fight against a particular virus or a bacteria, where we sensitize our natural killer cells, and lots of different cells are sensitized to fight a specific enemy, SARS coronavirus 2 for example, but it could be any virus or bacteria. So it's stimulating both arms of the immune system. Again, also convincing evidence that fever is good because it stimulates innate, non-specific immunity and adaptive, highly specific immunity. And it may reduce inflammation. So what seems to happen here is once there's a coordinating type of cell called the macrophage, and once they're sensitized, fever actually seems to reduce the inflammatory response. And we know in SARS coronavirus 2 that inflammation is a big part of this disease. And yet, why aren't people picking up on this? It's a bit of a mystery to me why more people aren't picking up on this. You would think by now someone would have done a trial comparing people with COVID-19, some where you treat the fever, others where you don't treat the fever. Then we would know. But it hasn't been done as far as I know. The specific pyrogens. Now, these pyrogens are largely cytokines. So cytokines, cyto is cell, kine for kainos, movement. So a cytokine, well, you've probably heard of hormones. And hormone, of course, is a chemical messenger that carries a message from an endocrine gland where that is produced to a target organ where it has some physiological effect on the target cell, organ or tissue. That is a hormone. But cytokines do much the same thing, but at a cellular level. So pyrogenic cytokine, an interleukin, is a cytokine, a chemical messenger that communicates between two leukocytes, two white blood cells. So these are very specific. And this one and others are known to be pyro, which means heat, genic, beginning. So heat, beginning, cell movement between white cells is the translation of pyrogenic cytokines interleukin. And this type of interleukin is called interleukin 6. So again, quite specific, a highly specific molecule working on highly specific receptors to bring about a specific physiological response. This is not some sort of mistake. It's good to have this pyrogenic, fever-generating response. Mounting evidence that the increase of 1 to 4 degrees centigrade in core body temperature is associated with improved survival and resolution of many infections. Many infections. So we're actually talking about, look at that word there, survival. You know, this is really important stuff. Why aren't governments around the world picking up on this? It really is a bit of a blind spot, you know. It is really strange. This is simple stuff because if you're watching this video now and you're paying attention, as an average intelligent viewer, you will have understood everything I've said so far. This is not honours degree level biochemistry here. This is just basic, simple stuff, and yet so many, even a lot of doctors don't seem to tag on to this. It's really quite surprising. You know, I mean, I've worked with doctors just in the past year or two, and as soon as someone's got a fever, they'll prescribe a drug to bring it down. And I say to them, at what temperature does the immune system work best? And they sort of give you a funny look. Well, I get funny looks anyway, but you know, they just don't seem to be thinking in that domain, that maybe the body is responding in an appropriate physiological way, and that it is arrogant to intervene with your fever bringing down pills, your antipyretics. Survival advantage to many infections. Now, is there a survival advantage to letting your fever run if you develop COVID-19 at home? Well, I don't know. The trials have never been done. But based on many other infections, I would think it would do. I don't know, but I would think it would do. Now, I'm not telling you what to do, but when I get a fever, I certainly try and avoid taking antipyretics. Let the fever run is, I believe, the most therapeutic strategy. You will feel worse, but for a shorter period of time. It's the difference between a causal treatment and a symptomatic treatment. So if I have an infection, suppose I have bacterial pneumonia and I'm feeling really ill, then you could bring my temperature down and I'd feel a bit better. But that's treating the symptom. That's treating the fever. Whereas if you give me antibiotics that are sensitive to the bacteria infecting my lungs is sensitive to, then that's treating the cause. So it's always better to treat the cause nearly always better to treat the cause rather than treat the symptoms. So really, at best, these are symptomatic treatments, not causal treatments. Trouble is, of course, with SARS coronavirus 2, we don't have a causal treatment. We can't kill the virus. I wish we could. Same for many viral infections, unfortunately. Use of antipyretic drugs correlates with a 5% increase in mortality in influenza. So in influenza, simple flu, this has been done. Now, of course, the mortality with simple influenza is relatively low, but it's not none. It's not. There is a risk. So use of antipyretic drugs correlates with a 5% increase in mortality. So let me put that in another way. 5% more people die in influenza if you treat it. Now, of course, many of us do at home, but this study's been done. Overall, more people will survive. Now, we're talking about very low percentages here, but that statistic is still in the research. So 5% increase in mortality in influenza. Is there an increase in mortality in COVID-19? Don't know. Never been done. Research hasn't been done. Do I suspect there is? Yes, I do suspect there is. Negatively affects patient outcomes in intensive care units with influenza as well, so they don't do so well if you lower their temperatures in people that are very poorly with influenza. Now, it's not saying this is always, so uncontrolled fever is associated with worse outcomes in sepsis, or, for example, if someone's got neurological injuries. So it's not always true. What we're basically talking about here is infection. So, for example, if someone's got sepsis, well, sepsis is a cytokine storm, isn't it? That's what sepsis is. Lots of cytokines being released, stimulating massive inflammatory reactions around the body. So some research suggests that it's good to treat fever and sepsis. And for neurological injuries, with head injuries, there's no doubt about it at all. So if someone has a head injury and they've got normal body temperature or even high body temperature, the metabolism's increased. And if the blood supply is reduced, that greatly exacerbates neurological injury. So in head injuries, we want to keep them normal temperature or even cool them down. So it's not in all things, but of course, this is sepsis really is an abnormal reaction to an infection. A neurological injury, of course, is a trauma. So we are talking about normal, straightforward infections here. Now, just to get another expert opinion, this is Dr. Offord. I think he's just been writing. I think this was he's mentioned in a recent article. I forget what paper it was now. It was it the New York Times? I think it was. Yeah. Anyway, Paul Offord, vaccinologist. Treating fever can prolong or worsen illness. These are direct quotes from his presentation. Watch it for yourself. So treating fever can prolong or worsen illness. I want my illnesses to be as short as possible, and I want them to get better, not worse. Fever enhances survival. That accounts for its persistence through animal evolution, even though it extracts a significant metabolic cost. Now, this is an interesting point. The body never uses energy if it doesn't have to. So when you're ill, if you think about a hunter-gatherer situation where humans developed, if you are ill, then you probably won't be able to forage for food for days, and the odds of getting up and making a kill to eat are very, very small. And yet the body spends a massive amount of its precious reserves of energy that your very life depends on to increase body temperature. Why would it do that if it wasn't really important? The body just conserves energy wherever it can. So a rise in 1 degree centigrade in body temperature requires a 10 to 12.5% increase in metabolic rate, using masses of energy. Why do you think you lose weight? If you're off sick with proper influenza for a week, you lose kilograms of weight. You lose loads of weight. I mean, part of that's muscle because you need to have protein to make the antibodies and the immune response, but part of it's fat and glycogen anyway, because you're just using so much energy. You become very catabolic. You start breaking down your own reserves. But the body's prepared to do that because fever's so important. Immunity, both innate and adaptive, works better at higher temperatures. So that's what some experts are saying. That's what the research is saying. So for otherwise healthy adults, for me, I can't tell you what to do, but for me, I wouldn't treat simple viral infections, because I believe I've given evidence that you're more likely to get better quickly and survive if you let the fever run. So next time you get sick, ring your own doctor, see what he says, and hopefully you'll work out a treatment for the cause rather than depending on symptomatic treatments. Okay, thank you for watching this video, of course, as always.